Okay, well, lovely to see everybody. Colleagues will be joining as we get going. So let me begin by acknowledging the first Australians on whose various lands that we're meeting on today. I'm here in the lands of the Ngunnawal and the Ngambri people, and to pay my respects to elders past, present, and for Indigenous colleagues joining us all over the country. I'm Sharon Friel. Welcome to Saving the World Webinar Series. So the webinar series comes to you from the Planetary Health Equity Hothouse, which is an initiative of the 5-year laureate project on governing planetary health equity and governance for planetary health equity. And in the webinar, I'm joined by my marvellous colleagues, the laureate research fellows, Nick Frank and Megan Arthur. And this is the first of the Saving the World series. And we thought it'd be really good over the course of the year, and actually over the course of the 5 years with the webinar series, to discuss some of those real challenges at that intersection between climate change, inequality, and health. But what we don't really want to do is dwell on the problem, although that's a very important thing. We do want to talk about ways forward, and hence the slightly tongue-in-cheek of saving the world. But we do want to focus on pathways forward. We really, really do. Having said that, what this year really is all about in the series is really kind of shining a light on the consumptogenic system and its structural origin. So whilst we will be talking a bit about the problem, within all of that, we'll be thinking about the ways out of it. And so over every month in each webinar, we're going to anchor the conversations around planetary health equity, but covering a big sweep of, well, of course, everything is completely connected to this issue, as we'll see, but we're going to be talking about issues of coherence, of industry practices, of power inequities across and within societies, of 21st century capitalism writ large, for example. And so we're going to move as well from all of these issues from the global through to the local as we progress throughout the year. So please, I do hope you stay with us on the journey of the seminar series over the course of the year, where we're going to talk about the issues, why is it a difficult thing to address, and what are the key things that can be done to address it. So today, so as I say, this is the first in the series. And we've got the team. This is the Hothouse team, or part of the Hothouse team, and we're speaking about the structural drivers of planetary health inequities, and particularly with a focus on growth models and issues of coherence. So we're just going to speak probably for about 30 minutes or so, and then we'll open up for discussion with yourselves. We are recording, so please do let us know if that's not acceptable to you. We're recording the presentations. We will not be recording the discussion, the audience discussion. It's just the presentations. And the reason for the recording is so that we can then make it available to people who haven't been able to join us at this point in time. We had over 200 people register for the webinar. So it's marvellous to see the interest in these issues. I've just given Nick and Megan a heart attack sitting here hearing the numbers of people who are listening in. So with no further ado, I'd like to just flip back into some slides. So give me a wee second just to share the screen. This one. Lovely. So can I just check? Yes, you can see that. So you might remember, some of you might have seen this slide before when we launched the Planetary Health Equity Hothouse, when we launched the Laureate project, and that was back in July, I think. and really just pointing towards the planetary health equity crisis that we currently have. So if we understand planetary health equity or planetary health inequity as the equitable enjoyment of good health within a stable ecosystem, we clearly do not have that. What we're seeing is and particularly in relation to climate change, I should say that most of our remarks are situated in climate change. Of course, planetary health issues are broader than that, but we are focusing on climate change. And climate change has already locked in and will exacerbate intergenerational inequities. We're already seeing the locked-in effects from climate change on global economic inequities, and we're seeing the exacerbation by climate change of existing social inequities. And all of that is affecting health inequities, because health inequities are affected by these wider social and environmental factors. And the questions that we're asking in the hothouse is, what's causing these problems? What's causing this interconnection between these problems? Why is so little effective remedial action happening? That's our starting motivation, is that there is just not enough effective remedial action happening to address planetary health equity. And then that really important question of, so that we're not just talking about the problem, is trying to understand what are the conditions that will enable effective action to occur. So if you stay with us over the journey of the 5 years, I'm hoping that we will answer this to some extent. And so our focus is on that intersection between climate change, inequality, and health, very much through a systems lens, a complex adaptive system. So that gives us hope. Things are always changing. And the question is how to inform those changes in a way that improve planetary health equity outcomes. And to really get at these questions, we are taking a very strong political economy lens to this. We're examining issues of power and fundamentally questions of governance. And we're doing it across these 3 subsystems: economics, energy, and food. So what do we think we're going to try and provide through the roadmap towards planetary health equity? We have this very grand vision of providing a roadmap towards planetary health equity. Well, the question of what does ambitious public policy, and particularly ambitious climate change mitigation policy, look like that optimizes absolutely the environmental outcomes, but also the social and the health equity outcomes? What does market activity, what does broadly economic activity look like that serves planetary health equity interests and goals? And then fundamentally, what does a multi-level governance system look like that's fit for purpose? And that fundamentally, we argue, is a governance reset. So at the core of all of this, our argument is that there is this harmful consumptogenic system, and we've described this as the system of institutions, of policies, of commercial activities, of norms, social and institutional norms that are really absolutely incentivizing and rewarding the production as well as consumption of fossil fuel goods and services. And that those goods and services many of them are bad for human health as well as planetary health, and they are very unequally valued and distributed. And so the big question is, how do we transform? How do we understand that system, find the points of intervention in that system in order to transform it to have the better planetary health equity outcomes? And that's the big question for us at the core of governing for planetary health equity. What are the different ideas and interests and institutions that are at play that are either working to maintain the status quo in that consumptogenic system, or move us towards to transform that system towards planetary health goals. And fundamental to all of that, as we're about to hear from Nick and Megan, are understanding growth and growth models and understanding coherence within these systems. So that's just really a reminder of what the Planetary Health Equity Hothouse is trying to achieve. We're early in the days of, we haven't answered all of that yet, but I'd like to hand over first to Nick, and then we'll come to Megan before we open up for discussion with yourselves. Nick, over to you.
Great. Thanks, Sharon. So today I'm going to talk about the Australian growth model and really the politics that have given rise to the growth model, the economic foundations of that model, and the way in which that model impacts the achievement of planetary health equity outcomes. So, comparative political economy has a kind of broad and deep body of work that's focused on inequality. There is kind of nascent literature on climate change, but public health is not really tackled in that literature at all. The work that's been done, cross-sectional work that's been done on public health has predominantly come out of the public health literature and not comparative political economy. So needless to say, there's almost no work done in comparative political economy on the interaction of climate change, economic inequality, and public health outcomes. So we are working on a paper at the moment which is attempting to kind of lay the foundations for a comparative political economy of planetary health equity. And as a first step, we are looking at the Australian case and the sources of growth in the Australian economy. So the question we're ultimately interested in, or one of the questions we're interested in, is how variation in the operation of capitalism influences the achievement of planetary health equity outcomes. And so, coming from a political economy background, my first inclination was to look at the varieties of capitalism literature, which is the literature that has dominated since the early 2000s, since Peter Hall and David Susskind wrote their influential introduction to the varieties of capitalism book. And there are a number of problems with varieties of capitalism. I'm not going to go into all of them, but ultimately, some of these issues stem from the macroeconomic underpinnings of varieties of capitalism. So varieties of capitalism is based on the neoclassical synthesis or the neo-Keynesian synthesis that places all of the emphasis on the supply side. Recent work led by Baccaro, Hodgson, and Mike Blythe reorientate the analytical lens and place it on the demand side. So they operate from a very different macroeconomic framework. So they've got different macroeconomic assumptions that underpin their work. So rather than focusing on the supply side, they focus on the demand side. And there's several advantages to this. One is that it means that questions of equity are really front and center, because aggregate demand, at least to a certain extent, is determined by the level of quality within an economy, or inequality within an economy. So that's helpful for some of the questions we're interested in. And then because it's focused on the demand side, it takes the political emphasis away from producer groups and towards electoral politics. So producer interests still matter, but electoral politics are integrated into that framework. So this is the framework we use in looking at the Australian growth model. Okay, so I'll give you a little bit of background. So since starting in the late 1970s, early 1980s, and really coming to a head in the 1990s, we've seen a collapse of what is referred to as the Fordist model. So basically, wages, there's been a divergence in wages and productivity across advanced economies. So put another way, we're producing more stuff, but people can't buy that stuff. So a substitute has had to be found. And the substitute for many advanced economies has been rising asset prices combined with a permissive credit market that is used to basically smooth socioeconomic position or consumption. And we argue in the paper that for consumption-led economies, these mechanisms are particularly important. Okay, so turning to the Australian case. First thing to note is that growth rates in Australia have fallen since the global financial crisis, as they have across comparative economies. So in the paper, we look at both economies that are similar to Australia, consumption-led economies that are similar to Australia, like the US and the UK, as well as economies that are dissimilar, like Sweden, which has a more balanced growth regime, and then Germany, which has a clearly export-orientated growth model. So looking at the sources of consumption, you can see that Australia, like the US and like the UK, which are typically canonical examples of consumption-led economies, consumption plays a really important role in aggregate demand and in terms of GDP as a whole. So since the global financial crisis, domestic consumption makes up more than 40% of growth in Australia. It's not as high as in the US, but it's higher than in the UK. And it's significantly higher than in balanced Sweden or export-orientated Germany. We look at exports, we see that Australia, which is often thought of as an export-reliant economy, is actually not that reliant on exports. It's really consumption that drives economic growth in the Australian economy. So it's a very different story to an economy like Germany, where exports clearly drive economic growth, or even in balanced Sweden, where exports play a more important role as a source of economic growth. Okay, so those are the kind of macro growth drivers. In terms of the sectors that relate to consumption, there are really four sectors that are particularly important: finance and insurance, real estate, and construction. And looking at the finance and insurance data, you see that the Australian financial sector is larger than the American financial sector as a share of GDP, which is a pretty crazy thing when you think about it, given that the US really sits at the center of the global financial system. We think of the US as an incredibly financialized economy, and yet finance and insurance make a larger contribution to GDP in Australia. Looking at real estate, you see that real estate is roughly approximate to the share of GDP accounted for by real estate in Australia is roughly equivalent to that of the United States. Again, the US has gone through 30 years of basically a real estate-led boom. And if we look at construction, really none of the comparative economies are close to Australia when it comes to the role of construction in the economy. Some of that is related to investment in the mining sector, but a lot of that is accounted for by residential housing, which gives us a hint as to what the mechanisms that actually underlie the importance of those sectors are. So in the paper, we make the argument that there are two primary mechanisms that underpin the Australian growth model. That is asset price inflation, particularly house price inflation, and then a very permissive credit regime. So you can see that house prices in Australia have increased incredibly over the last 20 years or so, to the point that they're the highest out of the OECD, certainly the highest out of any of the comparative economies. And going along with that, we've seen increases in household debt, as well as declines in the share of households that own a home without a mortgage. And Asset price inflation stimulates consumption in two ways. It generates what's called a wealth effect. So as house prices increase, people feel wealthier, so they save less and consume more. It also is linked to a collateral effect where households can borrow more because house prices have gone up, and that borrowing is then used to fuel additional consumption of both housing and then additional goods and services. And then because Australia has an incredibly permissive credit regime, you have deep and liquid credit markets here, you've got deep relationships between banks and households, you see that households rely on credit to smooth consumption in the face of rising expenditures or shocks to income. So as, for example, healthcare costs have increased in this country, or educational costs have increased in this country, or just general inflation has increased, households are relying increasingly on debt to maintain their socioeconomic position. So looking at house prices, gives us a little bit more insight into what's actually driving the economic model here. So from 1900 to 1980, house prices, average growth for house prices was sub 6%. From 1980 onwards, it was more than 8%. Now, most of that growth in the post-1980 period has been accounted for by debt. So prior to 1980, almost none of the growth in house prices was accounted for by debt. That's actually 0.5%. So pre-1980, house prices were driven by wages and general inflation was much higher in that period. Post-1980, it's been largely driven by debt. And you have to bear in mind that inflation was lower in the post-1980 period, which means that debt actually played a more important role in house price growth. All of that is evidence of the role of credit markets in stimulating house prices, as well as the impact of house prices then on consumption via the wealth effect and via the collateral effect. Now, this model didn't spring out of nothing. It's maintained by a coalition of interests. We're using language from Coherent Pontisson, so we refer to this as a growth coalition. And this growth coalition is organized around a policy paradigm, and at the core of that policy paradigm sits maintaining asset price inflation and then maintaining a permissive credit environment. In terms of the interests, we have sectoral or elite interests or producer interests. So we've got the interests of the finance and insurance and real estate and construction sectors, as well as some labor interests. So for example, labor that's involved in the construction sector. We've got electoral interests. Both the centre-right and centre-left political parties have an interest in maintaining this growth model because they both market themselves as competent economic managers, and the asset price inflation and a permissive credit environment allow them to generate economic growth. Then you also have the personal interests of politicians. On average, members of the coalition own 2.4 homes, members of Labor own 2.3 homes. The Greens are a bit better, it's like 1.5 homes, so they own their own home and a holiday home, half a holiday home. So politicians are also deeply invested in the system, so have all sorts of incentives to keep it going. And ultimately what you have are the politics of policymaking and electoral politics. And the politics of policymaking, what Culpeper refers to as quiet politics, really involve macroeconomic policy settings, macroprudential regulation, which voters don't vote on, outside of probably a tiny handful of strange people like me that might vote for a party based on its macroeconomic policies. Most people don't care what APRA is going to do. Most people don't care about serviceability requirements. And they tend to vote for political parties based on other things, noisy politics. We can see the dominance of this growth coalition quite clearly in moments of crisis, because both the centre-left and the centre-right basically use the same economic levers to pull the economy out of a perceived crisis. So during the global financial crisis, you had the Labour government stimulating the housing market and relaxing credit rules to funnel credit into the economy. The coalition government did exactly the same thing during COVID. So that just illustrates the dominance of the growth model and the way in which the growth coalition has been able to influence mainstream electoral politics. And this has lots of implications for planetary health equity. As the rate of return on housing has outpaced the rate of return on wages, that has resulted in increases in inequality, particularly wealth inequality. And as inequality increases, so do negative effects for public health outcomes. As policy settings have incentivized the overconsumption of housing, this in turn has resulted in Australians living in and owning the largest homes on the planet. Canberra, where we're sitting today, is the capital city with the largest homes in the world. In turn, this is then linked to increases in emissions from both the production of these homes as well as the maintenance, heating and cooling homes. And then, of course, there are clear linkages between climate change and public health outcomes. As the Australian economy has become more reliant on credit, changes in credit market conditions have an impact then on the level of risk in the economy. And as we're experiencing today, as interest rates are going up, we can see the effects on households. And typically, the worst effects are borne by people lower down the income distribution, again, which then has linkages to planetary health equity outcomes. I'm not going to spend too much time talking about implications. We may be able to talk about this in the Q&A. I know I've wrapped it on for long enough, so I'll leave it there.
Great, Nick. So I hope for the audience, I hope you've got some questions building up. I mean, that you see the importance of why we dig deep into kind of the causes of planetary health equity, like what's right there behind this system. So that was marvellous, Nick. So I'm going to hand over now to Megan Arthur. Megan, I didn't really do a proper introduction of both Nick and Megan. Both the two relatively new laureate research fellows, and as you'll hear from Megan, we're a very interdisciplinary team, which is marvellous. I mean, you must come and join us for some of our discussions. We spend time delving into a whole variety of literatures as a consequence, but I do just want to acknowledge the marvellous work that both colleagues have been doing in driving this. So over to you, Megan.
Thank you.
No pressure.
Thank you for that introduction. So as Sharon said, we're kind of at the start of developing our work in the hothouse. And an important kind of central question that we'll be looking at is, what does coherent governance for planetary health equity look like? So I don't have an answer for that question quite yet, but it is what we'll be working on over the coming years. So stay tuned as we unpack these things. Well, today what I'll be discussing is a framework for thinking about the multiple dimensions through which we need to address this question, and through which we need to investigate the power dynamics and the politics that Sharon mentioned in her introduction. So our starting point, again, as Sharon said, is the recognition of the intersection of multiple crises. So of environmental and social inequities, and how these intersect and compound in contributing to health inequities. So this is fundamentally an intersectoral issue. And within the health community, and the sustainable development community, there's discussion about the need for policy coherence to achieve health and sustainable development goals. So goal 17, which sets out the means for implementation of the sustainable development goals, has a specific target on enhancing policy coherence. So coherence here is, and often within the health and sustainable development literatures, it's framed as policy coherence. So this is often conceptualized as intersectoral coherence across sectors of government and their policy outputs. So for our work, this would lead us to thinking about coordination across the many sectors that shape planetary health equity, that shape climate change, social inequities, and health inequities, such as the environment and health, obviously, but also trade and the economy, finance, agriculture, food, et cetera, as well as housing, as Nick has just discussed. So we often hear, with respect to policy coherence, we hear about whole of government approaches, or health in all policies, or development in all policies. And in our work, can you just go back, Sharon, please? But with respect to what Nick was discussing, provides a kind of specific example that's quite useful for demonstrating the utility of the concept of governance. So in our analysis of economic growth models and housing and the climate change and social equity and health equity implications of that, we can see that the growth model in Australia, which is supported by a coalition of political and economic actors, may contribute to positive outcomes for growth, but then has potentially negative outcomes for emissions, greenhouse gas emissions, which then, contribute to health inequities and also for social inequities, which compound that kind of intersectoral relationship. So we can argue that this economic growth model is incoherent with environmental and health policy goals and social equity goals. So the coherence of policy outputs, as I said, is an important starting point, looking at government sectors and how policy coheres within that space. But we also want to build on this. So including policy outputs, but moving further upstream to studying and thinking about the politics of policy coherence. So this is discussed by Siitanen, whose work I draw on, and she works on policy coherence for development within the EU. And she advocates for greater attention to the processes of governance. So rather than merely focusing on coherent policy outputs, it's not just a matter of substantive arguments, as she says in this quote, but it's also a matter of the politics behind the policy outputs and the policy outcomes. So this leads us to thinking about the wider governance context in which government functions. And we recognize that there's an important and a crucial role for the state, but they exist within a broader context of actors and levels of governance spaces. So one important aspect of this is that we recognize that there's a proliferation of actors that engage in processes shaping outcomes for the planet, for social inequities and for health inequities. So both, these actors interact with this state, but they also their own practices and actions and governance models and the way they affect wider governance contexts has implications for planetary health equity. So the actor triangle provides a way of capturing the categories of different types of actors, the state, civil society, and the market, as well as hybrid actors, which we're trying to capture some of the complexity of what is fundamentally quite a simplification of the actor landscape in governance contexts. But it nonetheless helps us to conceptualize the range of actors that are involved. So within this complex multi-actor landscape, we can see intersectoral coherence, so that sort of traditional notion of policy coherence, as one part of what is needed. So coherence across the state, across government departments, but Siitanen also discusses the need for inter-organisational coherence to achieve, the wide-ranging changes that are needed for development in our work for planetary health equity. So when we're looking at this conceptualization, though, of this actor triangle and of the need for these different aspects of coherence, often we're thinking of a single level of governance. But of course, we know that processes and dynamics at multiple levels are linked. So here we've conceived these levels as supranational, which includes global as well as regional, national and subnational, which obviously includes multiple levels of governance as well. So in terms of building a picture of the complexity of the governance landscape, we can envision the actor triangle at multiple levels in terms of these multi-level dynamics. And therefore, there's a need for coherence across these levels to promote policies and practices that ultimately promote planetary health equity. So a very obvious example of this would be the supranational UNFCCC, so the UN Framework Convention on Climate Change, Conference of Party negotiations, and how those interact with national level and subnational level governance spaces, and also how multiple actors in relation to that supranational governance space relate to that at multiple levels. So at the global level, C2Net also identifies the need for coherence in governance processes across intergovernmental organizations, and she terms this multilateral coherence. So for example, this could refer to coordination of guidance to member states on climate change and health between the UN Framework of Convention on Climate Change and the World Health Organization, or between the World Meteorological Organization and the World Health Organization, which does occur. So if we put all this together, we can identify some of the parameters of what we need to think about of what coherent governance for planetary health equity would look like. And we get a framework for conceptualizing the spaces and dynamics through which to analyze the politics and the power dynamics, as I said, that shape planetary health equity. And ultimately, this, in terms of the goals of our work, this is about identifying opportunities, levers to achieve change and to achieve transformational governance for planetary health equity and for tackling the consumptogenic system. So I've just presented a couple of levels here for simplicity, and we can always come back to this slide, but yeah, it essentially puts all of those pieces together and thinking about that complex governance framework. Now, within these various dimensions of governance, these different governance contexts, in which we can think about and analyze coherence, what is it that we're actually thinking about here? So what are the attributes of coherence that we would want to consider? And so in this, I'm drawing partially on Zelli et al., who identified the need for normative convergence. So thinking about ideational convergence, ideational similarity, convergence of institutional norms. And then in terms of governance functions and membership, they discuss synergy rather than convergence. So not to say that organizations should all have the same governance functions, rather their functions should be complementary and synergistic. And similarly, with organizational membership, synergy across different types of organizations should, among the organizations in a governance context, we want to have synergy in their membership. And then finally, we think about the coherence of actors and organizations' interests within a governance context, across governance contexts, within that kind of complex framework of governance coherence that I laid out. So you might say this concept of coherence is quite utopian, and there are inevitably trade-offs at the intersection of different dimensions of governance. But the point here is to outline a framework for unpacking some of this complexity, and through which we can kind of tackle those trade-offs more explicitly, more intentionally, and through which we can situate, as I said, those analyses of politics and power dynamics, and help to make explicit the ideas, the interests, and the institutions that kind of influence coherence across these aspects of governance dynamics. And all of this ultimately is with the aim of identifying the levers for transformative governance for planetary health equity among all of these intersections and relationships. So I think we're going to move on to discussion with all of you, and I'll let Sharon lead that, but I've also provided the references from my presentation, and feel free to reach out if anyone's interested in any of that.
Lovely. Well, thank you. Thank you so much, Megan. Let me just stop sharing before I come back to that. Awesome. So you've heard, I hope you agree with me, two marvellous presentations from colleagues, from Nick and Megan, really pointing to, isn't that terrifying, the cacophony of coherence that is the real world in which these decisions are being made, that wrap around, something like the growth model and those policies that Nick was speaking about. So maybe we could open